Pharmaceutical giant Mylan was at the center of criticism last year over rising drug prices. Mylan's EpiPen price increased by nearly 500% over 7 years. CBS News coverage of the life-saving device for allergies and public concern led to a congressional investigation. We spoke with Mylan CEO Heather Bresch for her first in-depth interview since testifying on Capitol Hill. Now she wants to take on the healthcare system. We met inside Mylan's 1 million square foot manufacturing plant in Morgantown, West Virginia. So have you ever allowed anybody like me in here before?
No, we've never had national media in. We've really never focused on Mylan from an external point of view. But obviously we felt like it's now time for us to tell the Mylan story. Our premise is to provide access.
Last September, Mylan chief Heather Bresch was called before Congress to explain why EpiPen's price had soared from about $100 in 2009 to more than $600 in 2016.
They use a simple but corrupt business model.
I'm not asking you a question. This is what you have done.
Did you sort of realize that after being crushed on Capitol Hill?
Well, let's just say I think a lot of misinformation and people had no idea, very uninformed about who Mylan is, the role we play in healthcare. 1 out of every 13 prescriptions, we're in everybody's medicine cabinet.
You could ask just about anybody and they say the price of drugs is too high.
And I agree with them.
Epinephrine, the drug inside each EpiPen injector, costs just a couple of dollars, but the design is what's added to the price tag. Why did the price of EpiPen increase 500% over the past decade?
Because we realized there was an unmet need. And so we made a conscious decision. The board, we put a business plan together to invest, to build public awareness and access. We are now in over 70,000 schools across America. We've donated more than 800,000 free EpiPens. And remember that that price incorporates the entire supply chain. But it was that investment over the last 8 years that would allow us to reach patients and save lives.
But you're saying that because you wanted to make it more accessible, it had to get more expensive.
Yes, that price went up because we were making investment, as I said, about $1 billion over the last decade that we invested in the product, that we could reach physicians and educate legislatures. But then you also invest in the supply chain to make sure that, that employers, that employees, that everyone has access to have our medicine. Last year, 90% of EpiPen patients paid less than $50 for EpiPen.
But the list price is $600.
Yes, which is why I've said that if EpiPen needed to be a catalyst to show the system is broken, then so be it.
But I don't have to tell you, because you witnessed it in Congress, but there's a lot of patients at home who say it's pharmaceutical companies like Mylan that are the ones getting rich.
No, absolutely, and I understand that. And that's why I said I get the outrage, because it is so complicated and so complex, and the only face that you see on that medicine is the pharmaceutical manufacturer, where in reality, there's at least 5 entities touching that product.
In fact, Bresch says that for every $608 EpiPen 2-pack, Mylan receives 274. The remaining 334 go to other players in the supply chain, middlemen including pharmacy benefit managers, or PBMs. The president of the National Association representing America's PBMs told us that Mylan stands out for its refusal to accept responsibility for its own high prices. PBMs, which reduce prescription drug costs by 30% for employers, unions, public programs, and the patients they serve, are part of the solution. President Trump has said that pharma is now going to have to address the high drug prices. He's demanding change.
And I couldn't agree with him more. And I'm looking forward to it. I think if we've ever had a moment in time or administration that is willing to be disruptive, I think President Trump has shown that he is willing to make tough decisions, hard decisions, but right decisions.
So you would support the change in the law that would allow the U.S. government to negotiate drug prices for Medicare and Medicaid?
No, I don't know that that's the answer. What I would support is that we look holistically at how pharmaceutical pricing is done today and what is the best way to make it market-driven and give transparency to the patient walking up to that counter, that they know what they're buying.
So who are your allies in this effort to fix the system, the pricing system?
You know, it's going to be a coalition of a lot of interesting groups. Employers. Employers are frustrated. Employers know their health care bills going up and up, and they're hearing from their employees who are dealing with these soaring deductibles. So I think the administration is going to be an ally, and I hope every mom out there is an ally. As I said, I can't do this alone, and I don't have all the answers, but what I can tell you is I'm going to work tirelessly to get the right information and to strive for that transparency that's much needed in the system, and to make sure that patients can have the medicine they need.
Mylan has introduced a generic injector in response to criticism. It sells for $300. That's half the price of the EpiPen. And she makes a really interesting point, too, which is that, and I know this, from my own experience, we're noticing the high cost of drugs now because we have higher deductibles. Yes. My own healthcare plan, I have a $5,000 deductible. So recently I've gone to go pay for a procedure or pay for drugs and be like, wow, this is so much more expensive. I used to just pay the $10 copay. And under the new administration, they're talking about larger HSA accounts. So I think this is going to spark a huge debate. She's calling for transparency. Nobody else wants transparency.
But do you take her at face value that she genuinely wants to see change and transparency?
I do. I think that's very easy to malign a company very quickly over one product. I think it's harder for all of us as journalists to understand that the whole system, and everyone is taking a cut of this system, and there's transparency in an over-the-counter drug, right? Yeah. When you go and pick out an over-the-counter drug. There's no transparency in pharmaceuticals, and more and more of us are getting older. We're using more medications to live longer.
I could see, though, patients looking at that, Norah, and I'm not doubting her sincerity, but as a patient, you're still saying, why do I have to pay so much? It all sounds so great. So how much does EpiPen
But it's not just drugs, too. I mean, look at just for procedures cost more, too.
All,
yeah, the whole healthcare system.
Someone who had a procedure, I know exactly. I get the bill. I know what you mean.
Yeah.
So, but how much does the EpiPen account for their entire business?
So Mylan has about $10 billion in revenue, and the EpiPen is about $1 billion of that. So it is their top-selling product. An interesting thing I learned about Mylan, I didn't know, is they actually produce more than 88% of their company is generic drugs. So a lot of the generics, if you go home and look in your medicine, it's probably a Mylan drug. Yeah.
All right.
And we want you to see more of this interview with Heather Bresch, so we're going to post that on CBSthismorning.com, and we'll continue this conversation.